Healthcare begins with understanding. It takes vision to recognize what a community needs, and dedication to shape services that meet those needs with respect, clarity, and care. When leadership and action work hand in hand, real change becomes possible.
Our vision for addressing the needs of the Asian community is to be culturally competent, friendly, easy to use, and familiar.
We've done so much over the years to work together to tailor our services to really meet the needs of the community. We focus not only on healthcare and preventive healthcare, alternative healthcare, but on the communities in which people live.
So to be on the ground, listening to our population, listening to our partners, to learn what is necessary, what people want, and then to be responsive to them.
The goal is to be able to connect our members with the appropriate physicians, and especially in the settings of primary care, in order for them to have a setting that allows them to be comfortable to discuss their healthcare needs and their healthcare concerns.
Meeting people where they are means listening deeply. From the boardroom to the neighborhood, these efforts bring care closer to daily life through programs rooted in language, culture, and trust.
In 1999, we opened our first Chinese community center here on Mott Street. Subsequently, in the last few years, we've opened a community center in Flushing and a community center in Sunset Park in Brooklyn to serve this population, to help them live and age in the community with their family, with their friends, where they want to be.
Our company has gone through a tremendous amount of growth, specifically in the Asian community, and I think we've been able to establish a really excellent community brand that's known for really caring for our participant, that we're really instrumental in preventing falls. We're instrumental in keeping people out of the hospital, out of nursing homes.
Language and technology are some of the biggest barriers for the Chinese American neighborhoods. To help our community members address some of these barriers, we offer translation. We offer English conversational classes. We teach them how to use technology, cell phone. Community members had a hard time believing that our services and programming are free for everyone.
One of the biggest challenges we have is that we want to do so much for the communities, but we all have limited resources. So it's really important for us to prioritize our services and initiatives that are impactful, meaningful, and relevant to the communities that we serve.
We prioritize holding health events, and that is in order to be able to meet the members where they are and to be able to connect them with appropriate physicians and clinical community that addresses their specific needs.
We have an internship program and mentorship program, which we want to train more professionals to provide service to our participants appropriately.
Our team monitors our members' care needs on a regular basis. We work with their doctors and specialists, as well as them and their families, to design and individualize the care plan based on their specific needs.
We just opened a community office in downtown Flushing, which will provide access for the Asian community to be able to come in, talk to our benefit advisors.
We're here today with the Chinese community, but Elder Plan for many years has been focused on the community, focused on grassroots education. We are in the community to serve, to answer questions, and to really just help provide a great health plan experience.
Finally, the most important aspect of our efforts is compassion. We understand that each person has their own individual needs. We take the time to listen and serve each member to ensure that they are receiving the care that they need in the manner in which they feel most comfortable receiving it.
Impact grows through connection. By working closely with trusted partners, these teams build care systems that are not only efficient, but personal, familiar, and lasting.
We try to support the CAIPA physicians to the greatest extent possible, get out of their way with bureaucracy and administrative red tape so that they can do what they do best, which is to take care of their patients, our members.
We have worked very hard with organizations like CAIPA to enhance the primary care that people receive, because that is where it happens. That is the heart and soul of care in the Asian community.
One of our proudest achievements is the growth and continued partnership with like-minded partners like CAIPA. In fact,
CAIPA providers serve almost 1 in 10 members of our 2 million members here at HealthFirst.
I think the relationship we have with CAIPA comes from many, many years. I mean, I've been in this community for about 25 years already. Especially the event that we're partnering today with CBC is something that will provide a lot of benefit to not just the patient themselves, but also to all the providers that partner with us.
When leadership is guided by compassion and services are shaped by community voices, healthcare becomes something greater, a shared promise to care, to respect, and to serve with purpose.
If you are a member of HealthFirst, thank you. We will always try to do our best for you, and we will always try to do our very best to make sure that you get the best health care all the time.
We will continue to invest in partnerships with the Asian community. We will continue to expand our offerings, focus on health and wellness, and help our Asian members live better and healthier lives through their partnership with VNS Health.
It's how honored we are to serve you, and to serve you with respect, with dignity, and to always listen. We thank you, we are dedicated to you, and we feel very proud of the partnership we have.
Our commitment is to all those that we serve. The Asian community is very, very important to us. Top quality care is very important to us. We like to assure that we are providing everything we can to benefit those who we serve.